Hello. This is to introduce a simple low-cost ventilator, which would help treat patients with COVID-19, the novel coronavirus, particularly helpful for low-income communities around the world. And perhaps in more normal times also would serve as a CPR machine. Um, I also wanted to talk a little bit about a novel antivirus module that cleanses the exhausted air so that it is free of viruses or other pathogens. Here's a picture of our do-it-yourself ventilator, low-cost ventilator. And I thought it would be useful to point out this nice cartoon that illustrates what a ventilator does, which is basically get more oxygen into a patient who has patient's lungs, so who has the patient who has trouble breathing, and also uh, point out some of the typical specs, so typical terms that we use when we well, for a very basic ventilator, which is basically the breathing rate, the volume of air that's pushed into the lung, which is typically about half a liter or a pint, and also the inspiration expiration ratio, which anywhere from time ratio, which is anywhere from 1 to 1 to about 1 to 4. And all of these can be easily adjusted, programmed into the controller for our ventilator, as we shall soon see. So, following up on the video of the operation of this simple ventilator, I just wanted to quickly go over the kind of key components, all of which I was able to get online at fairly low prices. Um, so what you have, probably the main item is the manual resuscitation bag or ambu bag, which obviously would be supplied by the input air, which could be, you could add oxygen or through a humidifier, and that is squeezed into or pushed into the lung of the patient through that tube. And But the operation instead of the bag, the compression of the bag is, instead of doing it manually, is being driven by this gear rack, driven by a stepper motor, which in turn is controlled by the motor controller, and all of which programmed or set up. All those parameters, the inspiration expiration ratio, the beats per minute, all of that can be programmed through a microcontroller board, an Arduino board in this case, through a laptop, or actually even a smartphone through a USB connection. So those are the main components. Of course, I just forgot to mention power. So it's fairly low power needs. In this case, I've used an adapter, but could be easily supplied by a battery for remote operation. One of the options I think would be particularly useful is what I would call the virus deactivating module, based on a very simple, actually organic agents, deactivate viruses or other pathogens in the exhausted air. So you don't want, obviously, you don't want the exhalation of the patients to be exhausted into the open air. You want to cleanse it of the virus, and this module is a very low cost option that would do that fairly effectively. As I will describe in the next slide, more details on that. I did want to mention this novel virus neutralizing module that is also developed using commonly available low cost materials, but importantly, is able to scrub the exhausted air, the exhaled air from the patient, so that the air released to ambient is completely free of viruses and other pathogens. So this is an option that can be easily added, again, at very low cost. Oh, I'm hoping that this is helpful, actually, particularly to needful communities that are fighting this virus, COVID-19, around the world. I'm happy to share any details that may be interesting, useful if it's going to be at no cost, if it's going to be only for personal or low-income community use. And also, if there's interest in manufacturing, distribution, certainly the virus deactivating module, I think, is of particular usefulness. It can be done, included, along with the such ventilators or CPR machines, all at a cost of less than about $100. And my contact is here. So I hope this was helpful, and thank you.